So now coming to the treatment aspect, any patient with an apnea-hypopnea index as evidenced in a sleep study more than 5 with the symptoms has to be treated, or more than 15 irrespective of the presence or absence of symptoms has to be treated. Now the treatment, there are different modalities of treatment, but the time tested and the treatment modality with the best scientific backup or the best evidence to support improved outcome is what is known as CPAP, or continuous positive airway pressure, whereby there will be a small machine which will be providing air at a pressure, and that will be delivered to your airway through a mask. So when pressure is delivered at a pressure, then that will help to splint the airway, it will help to keep the airways open. So all these collapse during the night, the apneic episodes, all these will be prevented by this simple device. Now your doctor prescribes you CPAP and the CPAP is found efficacious, then on a prolonged period of time, when you use it regularly, the difference will be felt within a matter of days. The daytime sleepiness, daytime tiredness, everything will come back to normal and you will feel refreshed while waking up. And are there any side effects to CPAP? Not very much, but maybe some minor side effects, like if you don't apply with the adequate pressure, there can be some side leaks. And if you apply the mask with a very high pressure, then there can be some soreness in the nose. Other than that, hardly there are any side effects. But since this mask will cover your nose as well as your mouth, some will have some fear of closed spaces, what is known as claustrophobia. So if that is there, then you can go for a simple nose mask which will cover only the nose. Now literature or the scientific evidence is enough to suggest that a prolonged or continued use of CPAP will prevent all the complications mentioned before. It will also help to control whatever complications that has occurred, and the quality of life will definitely improve with the continued use of CPAP. Now other treatment modalities are some dental appliances in order to prevent the tongue falling backward, that has to be applied during sleep. Then surgery also can be advocated in certain subgroups, for example children where they have enlarged tonsils or adenoid glands that is contributing to the upper airway obstruction. So for them the removal of the adenoids and tonsils can improve the sleep apnea in children. So overall the take home message is obstructive sleep apnea is an important public health problem, but it is quite under recognized. So whatever symptoms you have, seek a doctor and do an evaluation at an early stage itself, so that the diagnosis is not missed and appropriate treatment is instituted.